Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Optic neuritis first, clinical features and the treatment. Clinical features, diagnosis and treatment of optic neuritis. So first, clinical features, the patient will have painful eye movements. These painful eye movements are seen mainly in the upward and medial direction. Why? These painful eye movements in upward and medial direction is mainly because of the attachment of superior rectus and medial rectus are attached to the optic nerve. So because the superior rectus and the medial rectal fibers are attached to the dura mater of the optic nerve, these will result in painful eye movement in the upward and median direction. Because it is attached to the optic nerve, see, these superior rectus fibers will cause upward pain on upward movement, whereas medial rectus causes pain in the medial direction. Because whenever there is optic neuritis, there is inflammation to the optic nerve. So because the superior rectus and medial rectus are attached to optic nerve, and because of optic nerve inflammation, painful eye movements are seen. Then along with that, there is Uttav's sign is seen. In Uttav's sign is there is the symptoms of optic neuritis will worsen either by increasing the exercise or by increasing the body temperature. The symptoms will worsen. Then we have Pulfrich phenomenon. In Pulfrich phenomenon, there is alteration in perception of moving objects is seen in Pulfrich phenomenon. In optic neuritis, we can do a visual evoked response. When we do a visual evoked response, we see that there is, because of the inflammation of optic nerve, there is delayed amplitude and delayed transmission time is seen in visual evoked response. Then if you see the treatment of optic neuritis can be treated by giving intravenous steroids are given, methylprednisolone is given for almost 3 days IV. Along with that, we give oral prednisolone for 11 days. So intravenous prednisolone is given, methylprednisolone is given for 3 days, followed by 11 grams of oral prednisolone is given for optic neuritis.
thank you and thank you for watching.